We have now this panel where we are going to discuss the international debate on public health innovation and intellectual property. We will start with the representative of the OPS, James Fitzgerald.
Muchas gracias.
It's a pleasure to be here with you again. Hello, Claudia, and hello to the members of the panel, to our colleagues from UNASUR and the Ministry of Health of Argentina. I know Claudia talked about the process of the consulting group, the CEWG, so maybe I could give you an update on what we are doing regarding the processes and initiatives that have been carried out through WHO and PAHO, and talk about some issues to be discussed, and also talk about future challenges and the global strategy. If you all agree, I would like to start right now. Okay. I believe that the region, as Claudia has said, has played an active role, a key role, both in the negotiations of the global strategy of public health, technology, innovation, intellectual property, and it has also been involved in drawing and drafting the various reports on these issues, reports related to funding of research, for example. Besides the PAHO and the countries in the region have worked with the councils of the PAHO to create a regional discussion. And here I'd like to mention the report prepared by the CEWG, or the Expert Working Group on R&D, as well as the demonstration projects which were accepted by the World Assembly. In 2012, there was a very active process taking place. 24 countries participated to analyze or to write a CEWG report, and 12 important conclusions were drawn related to R&D, the funding of research, etc. In 2013, a year ago, when the Assembly invited the regional WHO offices to analyze several projects to assess the projects. Well, 29 projects were submitted by the region, which were analyzed by the group that met in October 2013, and eventually the region submitted 4 projects to the WHO, set up mechanisms, and some other 4 alternative projects. In 2013, at the Assembly, 8 projects were approved, all the projects submitted by the regional offices, WHO offices, based on the criteria of the linkage. So that means that the cost of R&D would not be related to the final price of the agent, though it also took into account intellectual property issues. In March 2014, out of the 8 proposals, 3 were chosen, and they are already being implemented. So the World Assembly drove the implementation of 3 projects, and we expect to have a report about the development or to degree to which these projects have been implemented. This will be submitted to the executive committee of the WHO in January next year. Besides, another report is being prepared, which will deal with funding, look at the funding, at the partnership, at the collaboration, and also it will also describe innovation, what is being done in innovation, and it will explain to what degree the principles and recommendations of WHO have been accepted. Out of these 4 projects that were selected,
and they were pushed by different organizations in Brazil, and different aspects related to this project were seen as good ones to be implemented globally. So these are the projects, and this is information about them, information that is available online. We should now refer to the mechanisms of validation, the criteria, because there are different criteria. We are moving forward with that. Now let's move to something more essential, which is the global policy on public health. This strategy was started in 2008 and will last until 2015. As mentioned by Dr. Shams, there are 2 elements that focus on, in a very complex way, all the elements that are related to the different criteria, values, and principles required to push forward the expansion and innovation in public health. Now we are just coming to 2015, which is the termination date of this project, and based on a decision made by the Executive Committee this year, the General Director of WHO suggested that there should be a validation at the end of the period of the strategy. So validation will be in January 2015. They are suggesting that also that somehow copies the WHO validation policy is to have a group that will handle the validation process. Until March, they consider writing down the terms of reference for the validation to request member countries to comment on them. In June 2015, people will be consulted. The team that has responsibilities on the validation will also be consulted, and in August 2015, the idea is to finish with an action plan so that to ensure that the terms can be complied with, and the period will be extended to 2017. From January to May 2016, the progress report should be submitted by the 4 officers. So they are thinking about a very complex process. Some regions, such as one in Asia, are already having meetings, and we would expect that these meetings will come out with some validation ideas for 2017. There will be a meeting in Asia to discuss methodology that will be applied globally. And we should also include our suggestions. I think it is more important to listen to you than to continue talking myself and understand what you think about the processes being led by the WHO. There are many activities, and this is a very short time. For instance, the global platform on universal access to validation, to public health, I'm sorry. The projects, local projects, are moving forward too. There are many initiatives that are under progress right now, that are in progress right now. I think, I insist, it's more important to listen from you, your ideas, your opinions, than to continue talking, to listen your opinions about the projects that are in progress, and also your opinions and comments about the validation process that is presented. Thank you very much.